What do we really know about war? We watch the movies, maybe cry and leave the theater and go home to our own lives in the real world. Those are just actors. We almost forget that for some it is a reality.
My name is Sean Barry, and I was involved in the Vietnam War.
Donald Steele, and I was part of the Vietnam era.
My name is Kenneth Boger. I was in Vietnam. Weekly we were hearing the body count getting higher and higher. This is something our country was doing, and I had the obligation to do my share.
It's probably the hardest thing to do is to be balancing somebody's life in your hands. You're working with somebody, you're helping somebody, and they're dying. And you're the last person they have contact with. And you take that home with you that night, back to your hut, and think about it, and think about that every day, and do that every day for a year and a half or whatever. It takes a toll.
Post-traumatic stress disorder is an anxiety disorder that develops in some people who experience a dangerous event. This could range from a natural disaster to sexual assault to war. Now in Iraq and Afghanistan, 30% of soldiers are returning home to develop PTSD. The Vietnam War was the first time that PTSD was truly recognized as both a psychological and brain disorder. Before it had been referred to as shell shock. Now the diagnosis is surrounded by re-experiencing symptoms, avoidance symptoms, and hyperarousal symptoms.
There comes a point in war when they call going to the dark side. Once you pass to the dark side, home does not matter anymore. You know, it's survival, it's staying alive. You know, I wouldn't write home anymore. I didn't care if I heard from the people at all. That's crazy.
Survival is an instinct that all people have because of their fight or flight response. The fight or flight response is caused by the sympathetic nervous system, which prepares the body for action by dilating the pupils and increasing heart rate. In veterans with PTSD, this response is damaged since their sympathetic nervous system was so consistently alarmed during combat.
Once you're in combat, you age. You don't necessarily feel older, but you look older and you act older. When I came home, so many people said to me, "You look so different. You don't smile anymore. You don't look the same." And it changes you because of the things you see and the things you do. Up until going into combat, life was a game. It was fun.
Immediately upon return, they had a bunch of war protesters. There were, and they would spit at you and rip your ribbons off your shirts. Really were disgusted with what you'd done. It was really tough after coming back to find a job. You know, if you were a Vietnam vet, you were not getting that position. These are loose cannons. We can't have these guys around our people. You know, they're baby killers. They're, God knows all the things I went through.
There are 3 brain areas that are damaged or changed in people who develop PTSD: the amygdala, the prefrontal cortex, and the left hippocampus. In the limbic system, the amygdala is responsible for dealing with memories that are emotionally charged. Studies have shown that those with PTSD have a smaller amygdala. However, it is unknown whether this is because those with a smaller amygdala are more apt to develop PTSD or because the trauma actually shrinks it. Further, it was shown that severity, frequency, and duration of trauma does not cause the amygdala to shrink. This suggests that it is more likely that those with a smaller amygdala are more susceptible to PTSD. Further, the relationship between the prefrontal cortex and the amygdala is essential. fMRI scans have shown a connection between the amygdala and a conditional fear response. Meanwhile, the prefrontal cortex is associated with the extinction of fear. This suggests further that a large contributing factor to the development of PTSD is the dysfunction of the ventral medial prefrontal cortex to amygdala circuit, While the amygdala is considered hyper-responsive, the prefrontal cortex is considered hypo-responsive. The hyper-responsivity is postulated to be the reason that impaired fear extinction occurs in people with PTSD.
The prefrontal cortex, which is the part of the brain that basically reins in the amygdala, is often offline. And the hippocampus, which is a part of the brain that basically sets the trauma in a context that can be remembered, is also hypoactive. So that what you have is essentially, in neurocircuitry terms, a perfect storm.
A lot of people did not support the war, but they took it out on the veteran.
All of those days over there in the bush and thinking that when I get back, you know, I'm going to be one of America's best. They're going to put me on a pedestal. Oh my God, they try to put me under it.
When I left this country, people were still united, were still all together. When I came home into something that I had no idea how it would have changed in the 13 months.
I had my Marine Corps uniform on. I had gold wings because I was in helicopters, and I had ribbons that I had earned. And I got off the plane, and a woman walked up to me, beautiful woman with a dead rose in hand to me, and said, "Welcome home. How does it feel to be a killer?" Another guy came up to me and asked me how many kids I had in Vietnam. I was in the men's room, and a guy came in there and asked me if we spit shined our shoes, and I said, "Yes, sir." And he spit on them. He said, "Shine that, you commie." One of the guys I came home with was found hanged in the men's room. They said he committed suicide. He didn't commit suicide. We didn't come home to die, we came home to live. That day turned my life around, 180 degrees. I was a kid, and that day I became an angry man. When I was a kid, I was an altar boy. I went to a Catholic school. I played the accordion, I played the tuba. I was a virgin. I was great to my parents. And I loved everyone and everything. I was timid. I wasn't aggressive. But that day, I'll never forget it as long as I live.
When I came out, I was confused. I mean, I didn't know why I was having these horrible dreams and why I would wake up screaming in sweats.
One of the most prominent symptoms of PTSD are nightmares or flashbacks. These are involuntary memories of their time in combat.
In 1995 is when I finally had started losing my ability to maintain. I went into the West Haven VA in Connecticut and remained there for the next 4 years.
I've been through 4 marriages, 3 divorces, in and out of 7 colleges, God knows how many jobs.
In 95, when I went to the hospital, and my son had come with me to talk to my clinician because they had a family day, and he had looked at her and said, "Why is my dad always so angry?" And it tore my heart out. You know, I mean, he was 7 years old. I didn't realize that I raised him like I was still in the military, you know, and that wasn't fair to him.
The most important thing would be understanding that a veteran might react differently, especially a combat veteran. I have been out in places where there's a loud noise or some type of like say a crash in an accident. I've actually fallen to the ground when a helicopter has come over low. People have looked at me and laughed. Well, they don't understand, you know, why. They just thought maybe I overreacted. But to me, it's not an overreaction. That's a learned form of survival. You learn to react to noises, and to this day, I jump. I still do it. Always will. And I know I'm not alone. All combat veterans that I know have the same problem.
Scientifically and politically, there's much that can be done to help veterans suffering with PTSD. A study proved that 0% of those with an amygdala lesion develop PTSD. On a neurological level, PTSD is a disease of the amygdala. The answer is not no amygdala. Instead, time and money should be spent researching whether people are born with a smaller amygdala or it shrinks after war. Then, as a precursor to enter any branch of the military, people would have to be tested for a smaller amygdala. If they have one, they should be given the option to either enter the Army at their own risk or not. This could save lives. Further, at this time, there are so many nuanced ways in which people are dealing with the issue. Virtual reality games have proved to be a great help, and recently it was found that playing Tetris could severely help those with PTSD. For patients, focusing on a highly engaging visual spatial task could significantly reduce their occurrence of flashbacks.
It's nice that in recent years, people, since 9/11, things have changed where people better understand veterans now and are willing to come forward and say thank you for your service. And that's nice, because that never happened, really prior to that.
The best thing anybody can do for a veteran is to give them their time. When I go to the Veterans Hospital in Albany, there's hundreds of men and women up there who are pretty much dysfunctional for life, either emotionally, physically, mentally. It's permanent. And they're very limited as to what they can do with their life. A lot of them are restricted to a hospital for the rest of their life, maybe even a hospital bed or a wheelchair. They don't want money. They can watch movies, they get fed. But what they need is other people. So the best thing anybody could give a veteran is their time.
Ultimately, for any progress to be made, this issue must be taken on by scientists, the government, the people, and veterans themselves.
I seriously believe that this is the most wonderfulest country there is. I think lack of education allowed wars to happen. People's bad judgments. I think in today's world they should be able to sit down at a table and figure it out. I mean, we have all of the right things. We know what it takes to pacify a person, and you got to give and take, and it should be all peace. There's no reason for war.
We're all here together. We're all in the same boat, so to speak. And there may not be a paddle, but let's use our hands, okay? We can do it together.
I believe what it says on the back of a dollar bill, one nation under God. I believe in God. I believe in a creator, and I believe we're all created equal. And to take 300 million people and put them in North America and have so many oppositions, I mean, have you ever seen a bumper sticker that said, Yankees suck? Yeah. That's nice. Well, I'll tell you what, Boston Red Sox, if there were no Yankees out there, you'd have nobody to play against. This country, America, is at war with himself constantly.
Today, I don't believe there should be any war.
My name is Kenneth Boger.
My name is Sean Barry.
Donald Steele.